Of the three vaccines we have in the U.S., is one more effective than the other two?
So that is an open question at this point. We know that all three work very well at this point in time to keep people out of the hospital and keep them from dying. There is some evidence that the Pfizer and the Moderna vaccines may work better than the Janssen vaccine to prevent people from getting symptomatic illness with COVID-19. But those studies are still ongoing. And, the vaccine that works the best is the one that people get in their arm.
And this is the last question. What do we, and we as a society, as the healthcare community, need to do differently in the future to prevent another outbreak like this from occurring?
So there's a couple of things that I think would be important for us as a society, and that is to strengthen our immunization or our vaccination infrastructure. We need to be providing other routine vaccinations so that people are well informed about how vaccines are made, their risks and benefits, and that we have a number of places around the state that are easily accessible, that are familiar with vaccines. They know how to maintain the cold chain and how to deliver it efficiently. We don't need to be developing a vaccination infrastructure in the middle of another pandemic. The other thing that I hope people will do in medicine is that we will do better at communicating with our patients so that people have the skills they need to make informed decisions about vaccination or about any other healthcare decision they need to make. It's really important for people to understand the risks and the benefits, and people are struggling with that right now. And I think if we are able to fund our medical system to be able to do that better, that would be something that would help us prevent the spread of a illness like what we're experiencing today. And then there's two other things that I want to point out that I hope people will take to heart. One is it's important to fund public health. Public health, when it works really well, nothing happens. And it makes it hard for public health to be funded because nothing is happening. So why would you fund someone to do nothing, so to speak? So we need to learn more about the function of public health and make sure that it's well, the infrastructure for it is strong. And that is by providing it consistent funding. And the other thing is for the public to understand the public health interventions. A lot of times when public health interventions go into place, they work and nothing happens. So people think, well, that was a waste. Why did we do that? All right. But it's because it worked. And people need to think a little bit differently about public health because some of the things are counterintuitive.
Wonderful. Well, that was all of my questions. Thank you so much. Is there anything else you'd add or like to say?
Well, I just want to make sure that people know that the vaccine is provided at no cost to them, and that it's widely available around the state. And if they are looking for a place to get vaccinated, they can call 1-800-985-6030.
Wonderful. All right, Dr. Dillaha, I very much appreciate it.
Well, thank you very much. I enjoyed it.